Welcome back to our podcast. I'm Caleb.
And I'm Karthik. Today, we're diving into an incredibly important topic: raising awareness and early detection of chronic kidney disease, or CKD.
CKD is often referred to as a silent killer, and for good reason. Many people don't realize that they have it until it's quite advanced. But fortunately, the good news is that early detection can make a huge difference in managing the disease and improving the outcomes.
Absolutely, Caleb. Throughout this episode, we'll be discussing the importance of early detection, the various tests used to diagnose CKD, public health campaigns, educational resources, lifestyle changes, the role of healthcare providers, community involvement, and we'll end with a call to action. Let's get started.
On to segment 1.
Segment 1: Importance of early detection. Early detection is crucial in managing CKD. When CKD is caught in its early stages, patients have more treatment options and a better chance of slowing the progression of the disease.
In fact, studies have shown that early detection can significantly improve patient outcomes. For example, patients who are diagnosed early are more likely to maintain their kidney function and avoid the need for dialysis or kidney transplant.
Routine screenings and checkups are essential. Many people with CKD don't experience symptoms until the disease is advanced, so regular testing is the best way to catch it early.
Now, let's get into some statistics. Now, you might see the 1 out of 3 on the screen. Well, that's because according to the National Kidney Foundation, 1 in 3 American adults are at risk for CKD. This is why early detection through screening can reduce the risk. Are important because they can reduce the risk of kidney failure by up to 50%.
And remember, if you're listening and haven't had a checkup in a while, now is the time to schedule one. Early detection can truly save lives.
Now, another aspect of early detection is the potential to prevent complications. You see, CKD can lead to other health issues, such as cardiovascular disease. So, by catching it early, we can manage CKD and reduce the risk of these complications too.
Exactly. It's also important to consider the economic impact. Early detection can save healthcare costs by avoiding expensive treatment required for advanced CKD, like dialysis and transplants.
There are also psychological benefits to early detection. Knowing about CKD early on allows patients to mentally and emotionally prepare and seek support, which can improve their overall well-being and quality of life.
For caregivers and family members, for example, early detection means they can better understand the condition and provide appropriate care and support. It fosters a team approach in managing CKD.
Now on to segment 2, screening and testing for CKD.
Let's talk about the common tests used to diagnose CKD. These include blood tests, urine tests, and imaging tests. Blood tests measure the level of creatinine, a waste product in the blood. High levels can indicate decreased kidney function.
And furthermore, urine tests check for the presence of protein in the urine. Proteinuria, or protein in the urine, is a common sign of kidney damage. Imaging tests like ultrasounds can help doctors see the structure of the kidneys and detect any abnormalities.
It's important to know that these tests are usually quick and painless. Blood and urine tests can be done in your doctor's office, and imaging tests are non-invasive.
Now, when it comes to frequency, individuals at risk should get tested at least once a year, because risk factors include high blood pressure, diabetes, and a family history of kidney disease, and being over the age of 60. So, if you experience one of those said risk factors, you should certainly consider.
Personal stories from people who discover their CKD early through screening can be powerful. For example, Jane, a 45-year-old teacher, discovered she had CKD during a routine checkup. Early detection allowed her to make lifestyle changes and receive treatments that can slow the progression of the disease. This is anecdotal.
Now, Jane's story is a reminder of the importance of regular checkups. If you have any risk factors, talk to your healthcare provider about getting screened for CKD.
Another method of early detection is monitoring blood pressure. High blood pressure is both a cause and a consequence of CKD. Regular blood pressure checks can help catch CKD early.
Educating patients on the importance of these tests and screenings are crucial. Many people avoid medical tests due to the fear or lack of understanding of them. So, providing clear information and reassurance can help alleviate these concerns.
It's also worth mentioning home testing kits for kidney health. These kits allow individuals to monitor their kidney function from the comfort of their own homes, providing another layer of early detection.
While home testing kits are helpful, it is really important to follow up with a healthcare provider for a comprehensive and more accurate evaluation if any abnormalities are detected.
Another important thing to mention is that home testing kits can sometimes be expensive. So here at Renal Reach, we always recommend you check in with your local physician for help.
Now on to segment 3, public health campaigns and initiatives.
Public health campaigns have been instrumental in raising awareness about CKD. One successful campaign is the National Kidney Foundation's Kidney Disease Are You at Risk campaign, which encourages people to get screened for CKD.
Another notable initiative is the World Kidney Day campaign, held annually in March. This global campaign aims to raise awareness about the importance of kidney health and encourage preventative behaviors.
Government and non-profit organizations play a huge role in spreading awareness. They provide resources, education, and support for patients and their families.
Participating in local or national CKD awareness events can make a big difference. These events often include free screenings, educational seminars, and opportunities to connect with healthcare professionals.
By getting involved in public health campaigns and initiatives, we can help spread the word about CKD and encourage others to take proactive steps in managing their CKD health.
Another example of a public health campaign is the Know Your Kidneys initiative by the American Kidney Fund. This campaign focuses on educating people about the risk factors and symptoms of CKD.
Social media plays a significant role in these campaigns. Hashtags like #World Kidney Day and #Kidney Awareness can help spread the message to a broader audience.
Furthermore, local health departments can also run campaigns to raise awareness in communities. Collaborations with schools, workplaces, religious institutions, and community centers can amplify the reach and impact of these initiatives.
It's important to measure the effectiveness of these campaigns through surveys and feedback. This helps organizations refine their strategies and improve further awareness efforts.
Now on to segment 4, educational programs and resources. To begin with, there are plenty of educational programs and resources available for learning about CKD. Online courses, webinars, and workshops are great places to start.
The National Kidney Foundation offers a variety of educational resources, including the Kidney Learning System, which provides information on CKD, treatment options, and living with kidney disease. Hey guys, so this is a quick recap of the podcast you just watched. We'll also be going into much more detail on certain topics, so we highly recommend you stick to the end. So this is raising awareness and early detection of chronic kidney disease, or CKD, the recap. And I'm Karthik Shirbraz, and that's
Caleb Lee. Alright, now let's get going. So here's our agenda. Introduction to CKD, that's the first one. And next we got the importance of early detection, screening and testing for CKD, public health campaigns and initiatives, educational programs and resources, lifestyle changes to prevent CKD, role of healthcare providers, community involvement and support, case studies and success stories, challenges in CKD awareness, future directions in CKD awareness, and finally, the conclusion and call to action.
So I'll go first. So this is an introduction to CKD, and let's first understand what chronic kidney disease is. This is more of a recap from the beginning of our first podcast, but it's still important to know what it is. So first, let's go over the definition of CKD. Chronic kidney disease is characterized by gradual loss of kidney function over time, often classified into 5 stages, with early stages being asymptomatic, and in later stages you start to develop relatively severe symptoms like swelling in the hands and feet and higher blood pressure. Now let's talk about the importance of awareness. Raising awareness about CKD is crucial for early diagnosis and management, which can significantly enhance patient outcomes and reduce healthcare costs. One statistic we didn't go over yet is that, or we went over multiple times actually, is that 1 in 3 Americans are at risk for developing CKD. So again, the overview of this presentation is a journey throughout CKD's importance, methods for detection, preventive measures, and community-driven initiatives aimed at enhancing awareness.
That's right. Now let's begin with the importance of early detection. Now we need to recognize the need for timely intervention. So to begin with, impact on treatment options. Identifying CKD in its early stages opens up a range of treatment options that can slow progression and improve overall quality of life. Next, as we mentioned before, let's go into even more statistics on CKD. Now, currently, an estimated 37 million Americans suffer from CKD, highlighting a significant public health concern that warrants attention. And therefore, this is the call for regular screenings, as regular screenings are recommended for individuals at risk, such as those with diabetes, hypertension, etc., to watch the disease early and manage it effectively.
To put that 37 million American people at risk, right? The average football stadium can fit around, I would say, 60,000 people, right? So for 37 million people, you have 500,000 stadiums of people that just suffer from CKD, if I'm doing my math right. But let's go over to the next slide. Screening and testing for CKD. These are methods for early identification. So common tests include blood tests to measure creatinine levels, urine tests for protein present, and imaging tests that assess kidney structure and function. Now, let's go over the frequency of testing. Screening frequency should increase with age, existing health conditions, and family history, with annual tests recommended for high-risk groups. Now let's go over some personal sort of early detection. In previous episodes of this slide, we went over some anecdotes, which were based on real-life accounts from patients who detected CKD early through screenings and could motivate others to prioritize health checks and screening. This photo is by the National Cancer Institute on Unsplash.
Educational programs and resources. Online and in-person resources, such as platforms and local workshops, offer information about CKD, symptoms, nutrition, and treatment options. Support groups provide a safe space for individuals affected by CKD to share experiences and coping strategies, fostering community connection. And finally, educational initiatives in schools and workplaces enhance the understanding of CKD, promoting a culture of health awareness from a young age.
Lifestyle changes to prevent CKD. So first, let's go over some healthy choices for our kidney health. So first, you want to look at healthy diet. You want to adopt a diet rich in fruits, vegetables, whole grains, and lean proteins, which can significantly reduce the risk of CKD and enhance overall health. Next, you want to look at exercise. You want regular exercise. Now, physical activity contributes to maintaining a healthy weight and reducing hypertension and diabetes. Both of them are risk factors for CKD. It's also important to note that you should also do exercise that you like, so you can keep maintaining that exercise. For example, like I said before, if you hate running on the treadmill like me, then you can just play dodgeball or some fun sport, which can substitute in for that aerobic exercise. Finally, last but not least, a very, very important topic is to avoid smoking. Eliminating tobacco use is crucial, as smoking can exacerbate kidney damage and heighten the risk of CKD progression.
As for the role of healthcare providers, they help with checkups, communication, and they help you monitor and manage your disease. Healthcare providers are the first line of defense. Regular checkups can facilitate early detection of CKD, allowing for timely intervention. And as for communication, open dialogue between patients and providers foster a better understanding of health needs and encourages adherence to treatment plans. And finally, ongoing monitoring of kidney function and effective management plans can significantly influence patient outcomes and disease progression.
Now let's get into community involvement and support. Here we can foster a healthier environment together. First, I would recommend engaging with local groups. Collaboration with local health groups and organizations can amplify awareness efforts and provide resources to the community. One example of these groups is the Bay Area Association of Kidney Patients, which is a chapter of the National American Association of Kidney Patients. Now let's look at volunteer opportunities. Communities can benefit from volunteer-led initiatives aimed at promoting kidney health and education regarding CKD. Finally, on later episodes, you'll witness stories actually on real-life CKD patients, and this can foster empathy and motivate others to take proactive steps.
Now, here are some case studies and success stories. Now, case studies or successful interventions illustrate how proactive community efforts can lead to improved kidney health. And evaluating the outcomes of awareness campaigns helps identify effective strategies that resonate within diverse populations. And furthermore, our podcast and project as a whole will certainly cover real-life narratives that emphasizes the importance of early detection and lifestyle changes in managing CKD effectively.
Now let's go over some challenges in CKD awareness. Here we can navigate barriers. So the first is barriers to detection. Access to healthcare, socioeconomic factors, and stigma can hinder early detection and management of CKD. Now let's talk about some misconceptions about CKD. Common misunderstandings about CKD's causes and consequences can prevent individuals from seeking timely help and education. One of these misconceptions is how CKD is very rare and you have a very low rate of getting the disease. However, as we've seen before in previous podcasts, CKD is actually much more common than you think and can be caused by so many factors. Finally, I want to stress a need for improved education. There is a significant need to invest in education efforts to dispel myths and provide clear, accessible information about CKD.
That's definitely true. But now let's move on to more direct and practical focuses. Innovative campaigns. Future awareness campaigns may leverage social media technology and data analytics to reach broader audiences more effectively. As for technology, advancements can enhance early detection through monitoring of CKD through remote patient monitoring tools and apps. And we also want to emphasize collaboration among stakeholders because addressing CKD requires a concerted effort among healthcare providers, organizations, and community members to develop comprehensive strategies.
Finally, I want to bring us all together with a conclusion and a call to action. So, the summary of key points of this presentation. So, this presentation has emphasized the significance of awareness, early detection, community involvement, and innovation in addressing CKD. We want to encourage everyone to spread awareness, empowering individuals to share knowledge and advocate for CKD prevention within their communities is vital. Now, for you guys, the listeners, we have some next steps. So your listeners are encouraged to explore resources, participate in initiatives, and engage in conversations about kidney health. Thank you so much. So again, I'm your co-host, Dr. Prasad, and that's
Caleb Lee. Thanks for watching.
Before we sign off, I would like to correct a mistake I made earlier. So earlier I said that 37 million in the previous slide. I said that 37 million people in the U.S. are currently suffering from CKD. That's about 500 stadiums, actually, of 65,000 football stadiums. Imagine 500 stadiums right next to each other. Now imagine all those people suffering. That's just a small population of non-end stage kidney disease patients. So I highly recommend you spread CKD and follow these calls to action to prevent further suffering. Thank you so much, and we hope you have a great day. Signing off at Renal Reach. This is Karthik Prasad and Caleb Lee.
Thank you for watching.
Like and subscribe.